But you're not.
Oh no, it's an overlay. Yeah. Yes.
Hi, good morning. How are you doing? Good, I'm great. I'm great. Always a pleasure to be here on a Tuesday morning. Pleasant good morning to the listeners of 103.1 FM. Yeah, I'd make sure I'm breathing. I nearly said incorrect frequency there. Always a pleasure to be here from Batson Associates discussing health from a natural and integrated perspective. So this morning, this discussion, I decided to touch on a topic that I haven't spoken about in quite a while, and that is actually dealing with the men because uh, a lot of persons experience serious problems associated with poor prostate health. So I haven't discussed prostate health in a while, but it is something that is quite relevant, that is quite something that requires a lot of consideration simply because of the amount of numbers that we have as it relates to prostate and prostate BPH, which is benign prostatic hyperplasia, prostate cancer, even prostatitis, which is infection of the prostate. So this morning we're going to discuss what could men do to really address this particular situation with prostate health very early. And those of you who may have been told that you have a situation, at Batson Associates, we can actually give you great assistance with that. A pleasant good morning to our Facebook family, Miss Cathy Samaru, Miss Pamela Moses, good morning, Miss Angela Andrews, Miss Fatima Mohammed, pleasant good morning to you, Marissa Xavier. So when we're speaking about prostate health, as men, when we reach a certain age, our prostate would begin to enlarge a bit. That's expected. A pleasant good morning to Mr. Savage. So the thing is, the swelling of the prostate is expected. However, the issue is when the swelling is greater than normal. So as a result of that, you find it's very difficult for individuals to actually what we call pass water. So much so that men in the situation of a very serious prostate problem could actually end up with catheters. And catheters are devices that they will have to actually insert so that you're actually able to pass urine properly due to the fact of having enlarged prostate. So you find that that is a situation that, of course, is very uncomfortable because when you have a catheter, you run the risk of constant infections. Also, if it is you're married or involved with anyone, you cannot be intimate because that device is not a device that you can easily remove. It has to be removed by a medical professional. A doctor would have to do some surgical adjustments or some adjustments in removing it. So it's not something that you could take off and put on, for yourself. So therein lies the discomfort, the situation, of course, all the burning and the pain that an individual will experience. A pleasant good morning to Miss Joyce Dick, Miss Mary Elizabeth, Miss Angela Edwards, Miss Heather Singh, Miss Pauline McKenna, and Miss Tull. So with that, you find that in that situation, it is very uncomfortable for a man. You have issues. So of course, the question is, what do we at Batson and Associates do from an integrated perspective to really correct that situation? Well, one of the first things a lot of men need to do is they need to pay attention to themselves because your body speaks to you a lot of the times. The question is whether you listen or not. That's the thing because there are a lot of individuals who may have problems. And as a result of having those problems, you find that they actually in a situation now where they have stoppage of water, they have serious problems with urinating, they're having burning, they're having starting, stopping, they find the flow is not as good. So obviously, it needs to be something to be addressed because if it is left, you can reach the point where you could actually end up with prostate cancer, which of course we know is very deadly and can cause so much problems for individuals. Someone is asking Xavier about bone cancer. And, the thing is, interestingly, we're discussing prostate health and prostate cancer. So, it's very important, again, for men to have yourself checked out. So, what are some of the tests you can do? What do we at Batson and Associates offer? Are there some sort of supplement, some sort of vitamin, something that you could give your body to correct this situation? Because, of course, when you're dealing with benign prostatic hyperplasia or swelling of the prostate, you're actually addressing an inflammatory condition or dealing with high inflammation, which, of course, is the root cause of all disease. So when an individual sees that happening, it is obviously an indication of high levels of inflammation. What do you do? So I'm going to give you the telephone numbers, of course. There are a number of products that we carry at Batson and Associates to assist in reducing inflammatory response in any aspect of the body. So even though we're discussing prostate health, a lot of the times when these products that I'm going to mention, for example, the inflammation formula. Inflammation formula is a formula that is basically designed to reduce inflammation or inflammatory response in the body. And we know the link between inflammation and acid, inflammation and disease. Okay, so those telephone numbers that you can get us on, you can get us on 222-8261. That's 222-8261, as well as 314-9975. That is 314-9975. And those locations, we are located on the first floor of Money Talks building. That is Money Talks building in Montrose, Chaguanas. We are also on the corner of Ramsonwood Trace and the SS Erie Main Road in Delhi, as well as Red Edge Mall, Western Main Road, St. James, and the Triangle Building in Scarborough, Tobago. Those numbers again, 222-8261, as well as 314-9975. Also, keep in mind, you can check us out on Facebook. We are Batson and Associates Limited. And on Instagram, we are Batson and Associates TT. On YouTube, we are Batson and Associates Trinidad. So, we have a question. Okay, so I want to know if Santulan is safe for anyone to use. Yes and no. I'll explain quickly. So, Santulan is a 7-channel detox. It cleans and detoxifies kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. Now, those are actually your 7 channels of elimination. So when you use Santulan, it obviously is something that's going to help with increasing energy. It's going to help persons who have problems sleeping, women who may have problems with very painful menstrual cycle or may have issues associated with polycystic ovaries, fibroids, ovarian cysts, endometriosis, which is something I want to discuss next week, because this fibroid and endometriosis and polycystic ovary situation is just getting ridiculous. And so many women have to now be left in a situation where they might have to do a hysterectomy, which is a major surgery that can have so many serious ramifications in the short term, medium, and the long term, which a lot of persons do not take into consideration, simply because they may not have been given the advice. So that is something that is going to assist Santulan. Persons who cannot use Santulan, it's not that you could never use it, but because children 4 years and up could use Santulan. A person who may not be able to use Santulan at a particular point in time or immediately would be someone who's anemic. So if you have very low blood count and you usually have problems with weakness, very dizzy, tired, which would normally be the symptomology associated with someone who has low blood count, as well as someone who is dehydrated. And dehydration could be calculated simply by your body weight divided by 2 in ounces. That's the amount of water you're supposed to drink. And of course, you're supposed to be drinking that consistently for maybe the past 3 months. So if you have not been doing that and you skip on your water, you drink a lot of sodas, a lot of juices, a lot of coffee, then Santulan might be the product for you to use immediately. Now, there are some people who could use it and they wouldn't have any problem. But an ounce of prevention is better than a pound of cure. I always try to not have an individual experience what is known as healing crisis, or what is medically known as Hexaminer syndrome, which is where toxins try to leave your body faster than you would want it to leave. And as a result of that, it can actually cause serious problems, breakouts on your skin, headaches, and that, which is just an indication that the product is working, But we want it to work effectively to give you the less amount of side effects, if you want to call it. I wouldn't necessarily say it's a side effect, but it's simply a matter of us being able to dot our I's and cross our T's. And that is why, those 2 persons, we would recommend that in the case of the low blood count, we build your blood count up for you first, and then you could use the Santulan. And of course, in the case of the individual who's dehydrated, you do the water cleanse with that product that we carry at Batson and Associates, which is the Alkagen water, which is a premium alkaline water. And you use that maybe for like about a month time. And then subsequent to that, you could actually use the Santulan. Okay? So back to one of the things that we are discussing as it relates to prostate health. And this is something you wouldn't see a lot of questions, a lot of men do not call. And, if you want to be shy, no problem. I have no problem with that. But you need to get it checked, because there are too many persons who have lost their life to poor prostate health simply because They were ignorant of the fact of what they should have done and what they needed to do to really address the situation in its infancy and not leave it to exacerbate and get worse, which is what most people do. So, you know, men, if you're listening, don't wait for that. I mean, if you have done a PSA and the PSA is slightly elevated, you need to be very careful. I mean, this is not me criticizing anyone, but a lot of times, prostate protocols are not really effective simply because they do not address the root cause of the problem. I mean, if you have a problem with swollen prostate, most of the time you're recommended things like Flomax, Avodat. They would recommend Hitrin, which is terazosin. But those really deal with short term. You know, it's like a band-aid for a sore. It doesn't really address the root cause of the problem, and that's what you want. And 99.9% of all men who have prostate problems are men who have serious issues with gastrointestinal problems. So if you have poor gastrointestinal health, usually that in turn translates or eventually cause poor prostate health. Because remember, your colon and your prostate are neighbors. Your prostate is to the front of your colon. So you find bacteria, pathogens can leave the intestinal wall, especially if you have a compromised gastrointestinal system or other problems with bloating, gas, belching, constipation. If you have inflammatory bowel conditions like diverticulitis, Crohn's, irritable bowel syndrome, those type of things, you find that it is very easy for you to end up with a prostate problem. Okay? So those telephone numbers, again, you can get us on 222-8261. That's 222-8261, as well as 314-9975. That's 314-9975. If there's anything to help with what situation, I didn't hear the last part. Oh, hemorrhoids. Well, hemorrhoids usually are an indication of gastrointestinal imbalance. An individual who has hemorrhoids would be usually an individual who doesn't have proper bowel movement, so they may be a bit constipated. They may have to force. Stool is very hard, very dry. One of the first things you need to do, of course, is look at your hydration. How much water are you drinking? And that's where the Alkagen water comes in. The Alkagen water is a brand of water exclusive to Batson and Associates, which is particularly designed pH 9, which is designed to help reduce acid in the body. It is an alcohol. It has something known as ORP, which is oxidative reduction potential. So that can also help. What the person will also need to do, you should also include. There's a product we use at Batson and Associates called Laminine Digestive. There's also Digestive Balance and Digestive Restore. So any one of those would be able to help you. What I would also suggest you do is try and get some olive oil and drink a tablespoon of olive oil, sorry, every day. And that, yeah, a lot of O's there. And that is going to give you some assistance in that situation. Okay? So what the question is, what is the symptoms of bad gastrointestinal problems? Oh, good. Well, you know when your gastrointestinal system is really bad when you have been diagnosed with some sort of inflammatory bowel condition. So if you're diagnosed with Crohn's, irritable bowel syndrome, diverticulitis, or any of those, that is serious indication for concern because it means you have an inflammatory bowel condition, and the only thing you can go after from there is colon or colorectal cancer, which of course I don't think anyone wants. So, you know, I tell persons, ounce of prevention is better than a pound of cure. It's always better to address the situation. So from the time you're thinking you have problems with flatulence, bloating, gas, belching, constipation problems, you need to nip it in the bud and really deal with it in its infancy, as I said before, and not leave it to become exacerbated rather, and end up in a situation where it's worse, because that's exactly what's going to happen. It's going to get so bad that you're going to reach a point where it's going to be difficult to help you. It's not that we wouldn't be able to help you, but it is very difficult to help. So don't wait, you know, there's a saying where we say an ounce of prevention is better than a pound of cure. So that's very, very important. So feel free to give us a call. We actually have a special that we're doing for Christmas, which we're going to be posting up from sometime this week. I think Shaka and them would be working on it, so we would have it most likely organized by the end of the week, by the weekend. So that's something that you and your family could actually avail yourself of. So, you know, Christmas time, a lot of persons will be focusing on, you know, the house and the curtain and whatever the case may be. So, you know, we did a package for you guys to save some money. And then from next year, God's willing, so you could always do your tests and, you know, have your little Santuland, so for your little Christmas celebration, you know, get too blocked up and clogged up. And for the new year, you could actually start, Karen. But Karen, you're laughing, you know, for Christmas, people just go to town, you know, and especially with all this little lockdown, there was under lockdown there, so they're extra greedy. So, you know, you could always take a little 2-pack of Santuland and some water. So for the Christmas, you know, you're still in January and coming to us 10 pounds, 20 pounds heavier. You know, you might put on a 5 pounds as opposed to 10 to 15 pounds, you know, because you're going and eat your little black cake, your little pastel, you drink your little poncha creme, eat your little ham, that kind of thing. I and all this past anything, I tell people 2 things I do not share when it comes around. I don't eat it often, but when it's time, it's poncha creme and black cake. I don't share those 2 things at all. And pastel. Yeah, there is no share there. The love does end with those things there. So, you know, that's just to say that you could actually avail yourself of that package. And of course, the advertisements for that would be coming out by the end of the week on social media. And of course, when I do my programs, I'm going to highlight that. Also, keep in mind, this is, there's a question I said there. Karen? Okay. Okay, what's the question? Is it a good thing? So they want to know if compression stockings could help with varicose veins and what was the other thing? Well, the thing with compression stockings, they do help. I mean, I think for the day, you should actually wait like maybe 2 to 3 hours for the day. But you should give your feet some sort of rest because remember, that's actually squeezing. So you need to be very careful. You don't want to be doing that for an extended period of time. But in addition to that, you should sort and see if you could get some circulation tea. Even though we do not have circulation tea in stock, you could always put down your information for the circulation tea. And when we get in stock, we can always call you. That circulation tea works exceptionally well for those particular products. Okay, let me say a pleasant good morning to Ms. Dawn Ellis. Happy belated birthday to you. She had a birthday yesterday. She says, pleasant good morning, Dr. Batson Associates. I'm relaxing as I enjoyed my birthday. Today, actually, sorry, my apologies. So happy birthday today. Didn't have problem with my left foot swollen for the week. I have been using Santuland and some inflammation formula. The swelling has gone down and I'm able to walk. Okay, whoa. So that's a pleasant good morning to Ms. Ellis. And that's actually a testimony there. So you guys see, so, and we do have inflammation formula in stock. We do have a question again. What's the best time to drink olive oil? Empty stomach. So empty stomach is either 30 minutes before a meal, 2.5 hours after a meal. Well, 1 to 2.5, 3 hours after a meal, depending on what you eat. So if your meal is a very heavy meal, you're going to give yourself like about 2.5 hours. Then you can have it. If you have like maybe vegetables, you did salad or you had fruits, then give yourself about an hour and a half, right? So that's something that you could pay very close attention to. Someone is asking, what is your location? Or I think it's where they want to ask. Where is our location in St. James? We are located in the Red Edge Mall. Red Edge Mall is when you're heading on the Western Main Road, St. James. If you're heading in a westerly direction, you're going to come to, there's a food stall. Everybody know where Red Edge Mall is. Actually 2 malls on either side of the road. So there's one on the left and there's one on the right side. There's a fruit stall on the one that is on the left-hand side, and we are in the building on the right. Right? You could always put us in Waze, or you could search for us on Google, and Google Maps will give you the direction as well. Well, you wouldn't believe, that's a good question. I've actually had a lot of COVID patients that have been referred to me Some of them, their families called and gave us the information, and I just put together the package for them, and it sent it for them. It was delivered to them, and they have actually got tremendous results. I'm also treating a lot of people with long COVID, which is the situation where the lungs have been scarred as a result of the COVID, and they're getting problems to breathe and that type of thing. So there are a number of packages that we could put together. One product I always put inside of there is the silver, the colloidal silver that we carry at Batson and Associates, in the colloidal silver with the minerals. That works very well. And that product in some months is going to be getting a new look, because we actually changed the bottle, and everything is going to be coming in a new bottle, new label, everything like that. But very effective product as it relates to boosting the immune system. Honeybee says, good morning, doctor. And Shakil, good morning. So that's something that you could look forward to where that is concerned. The inflammation formula also helps. There's usually a product that we carry, which is the Laminine Immune. That is also a very good product for boosting the immune system, especially as it relates to persons who may have had COVID, or someone who's trying to be proactive and not actually get or contract COVID. Okay, let me also highlight a point. You have a next question, Karen? Okay, let me go to the question and then I'll make my point. If there is treatment for, of course, there are treatment for autoimmune diseases. What a lot of persons have to understand is, what is an autoimmune disease? I have given an analogy on numerous occasions. I think it's an analogy that most people don't forget. And that's the analogy with the stagnant water and the mosquitoes. So an individual who has an autoimmune condition, lupus, connective tissue disorder, MS, you will actually realize that in a situation like that, they have a lot of inflammatory response, a lot. And once if you don't address the inflammation, which Western medicine can't really deal with, because they will give you prednisolone. But prednisolone is a corticosteroid. It is a bandage. It does not really help. I mean, if you use it in the initial, no problem, but you can't use that for the rest of your life. You can end up with what is known as steroid-induced diabetes. There's steroid-induced arthritis. There is steroid-induced blindness, because that's one of the things that prednisolone do. It significantly damages your eyesight. It causes osteoporosis. It can cause serious problems with renal failure. So, I mean, that's not something you want to be using for an extended period of time. That doesn't make any sense. You need to address the root cause of the particular problem. What I also would like to say, just a quick note, I always talk about health, and, we have different types of health. You have your physical health, you have spiritual health, but you also have financial health. So, one of the things that health, financial health. So a lot of people are physically sick because they're financially sick. So that's something that we're gonna, myself, that's a project that I'm gonna be working on. But of course, I would not be having it on this medium, of course, because this is Batson and Associates. So this actually doesn't have anything to do with Batson and Associates, but it's me, Jason Batson, or Dr. Batson, that is going to be actually spearheading that project. But I'm, of course, going to highlight it on this forum so that persons will be directed to that particular forum. So look forward to that. We're going to be running some ads here for that, where we will be talking about financial health and, introducing you to some options. I have a very good friend, Mr. Kishon Vane. A pleasant good morning to you. I know sometimes he's locked on. He's going to be one of the persons who's going to be assisting me in that. So it's going to be some good information for you to take in, to evaluate, because, I always end my program where I say, if you think education is expensive, try ignorance. It doesn't pay to be ignorant in this world. We have information at our fingertips. Yes, you can't believe everything you see and read, but at the same time, you're a learned individual and you have some common sense, so you would be able to evaluate something and, take it for what it is. All right, so that's something you need to pay very close attention to. Yes, Karen? So this person had lasers done for varicose veins, correct? All right. Well, the thing, so they want some advice as to how do they go forward. All right. Well, the thing with that is well, once you have done laser, you need to be careful, because a lot of times sometimes you do laser and then afterwards they have serious issues because the veins are sometimes irreversibly damaged. Especially as time goes by. So you need to be careful. So what I would do, I would try and implement certain things in my protocol or my supplemental regime, your dietary regime, to actually address that problem. So circulation tea is one. That's something that I would look at. I would also look at, there's a particular laminine omega that we carry at Batson and Associates. That's one, because that actually has K2 in it, and K2 is one of the things that actually helps to unblock your arteries, and it also helps to remove calcium from the blood vessels and send it to the bones where it is really supposed to be stored. So very powerful product as it relates to circulation. So that's what I would do. I would work on my circulation assiduously to ensure that what you have done maintains its integrity and your situation doesn't get worse. I mean, that's the best advice I could give there where that is concerned. We have a next question? Mm-hmm. So an AST of what? 189. 89, and the other one is what? Okay, ASH and ALT. That has to do with the liver, you know. AST, ALT. Yeah, that has to do with liver health. That's an interesting question. Actually, there's a young man I worked with recently. Excellent testimony. We have to get a testimony from that family. It's a mother who brought in her son to us. And he was given a diagnosis that disturbed me because the doctor was saying they think it's Gilbert's disease, or I think it was Guillain-Barré syndrome, or some weird diagnosis like that. The person had a lot of inflammatory response. They were also showing early signs of liver problem. They were also looking as it relates to what's this thing, boy? Kidneys and their red blood cells, the white blood. They were in a mess, basically. Interestingly, I worked with this individual for 2 months, 2 months, 2.5 months, and sent them back to do the blood tests, and all the numbers improved. All. I mean, it was incredible. It's something that I expected, but I was so satisfied, you know, that this young man could now have good news, because when they came to me, he was so depressed. The mother was depressed. She actually thought she was going to lose her child based on that diagnosis. So it just goes to show how diet and food and, you know, a positive outlook as it relates to things like, you know, relaxation, even things like meditation and that type of thing could actually help as it relates to health. And his results was amazing. When I tell you amazing, and we actually have empirical data to show before and after, right? So which gives even more, makes our point even more potent, that you can, with natural and integrated medicine and a natural and integrated protocol, actually attain significant health and improved health, right? So that's something. So that AST and that other number has to do with your liver, I believe strongly. I'm going to check again to make sure that, but off the top of my head, I like 95% sure, right? And there are protocols that we can do for you to actually address that. Liver tea is something that's going to help. The kidney tea is also going to help. There's a tea we carry called Pu'er tea, which is very, very good. That's actually one of my favorites. That actually works significantly good as well. So those are something that you could pay very close attention to. Thank you very much, Ms. Moses. Okay, so keep in mind, you know, we discussed prostate health. We also have prostate tea in stock. So you guys, we have prostate formula and we have prostate tea. We didn't have prostate formula for quite a while. We weren't getting the product, and we were getting it, but we weren't getting the numbers that we usually had. All right, so that's something that we need to pay close attention to. So we close to finishing up. Okay, one question again. If someone doesn't have any heart problem or any circulation issue, can they do what? Can they use the K2 product? Oh, yeah, definitely. That laminine omega, you could definitely use it, because omegas is something that's supposed to be in your diet. And your diet's supposed to have at least maybe about 2,000 to 3,000 milligrams of omegas for the day. If you run a schedule like mine, or you're maybe in management or a supervisory position, or all it is being most stressed people in the world, you need to use those type of things. Nerve Restore is also a product. If you have problems sleeping, if you have problems with anxiety, depression, try that product. You're going to be very, very satisfied. Some of you might, it has 30 capsules in the bottle. Usually we recommend 1 a day, but some of you all just be kind of real a little badly off, so you might have to use 2 a day. But it's a very, very good natural, all natural, so it is not a habit-forming product, and it can help persons significantly with things like depression, anxiety, cognitive function, sleep, mood, that type of thing. So that's something you need to check out as well. Also check out our information on our different products, the eye optics formula, the nerve restore, the inflammation formula, the colloidal silver with the minerals. That's something to look for as well. So let me give you those telephone numbers again. Those telephone numbers you could get us on would be 222-8261. That's 222-8261, as well as 314-9975. That's 314-9975. Our locations, we are located on the first floor of Money Talks building. That's Money Talks building in Montrose, Chaguanas. We are also on the corner of Ramsonwood Street and the SS Erin Main Road in Baby, as well as Red Edge Mall, Western Main Road, St. James. Again, 103.1 FM, always a pleasure to be in your company. Karen, always a pleasure to be in your company. And until next week, please God, as we always say at Batson and Associates, if you think health is expensive, try sickness. If you think education is expensive, try ignorance. God bless you guys, and do enjoy the rest of your Thursday morning. Take care. Yeah. Yes, so I actually should have said that we continue a bit on Facebook, so I'm just going to try and run through some of your questions as quick as possible. Someone is asking, Ms. Heather Prince is asking, what causes cramping and tingling on one side of the head? You need to be careful. That could be early signs of ischemic situations taking place, so early signs of stroke. So you need to be very careful where that is concerned. What could you use at Batson & Associates? The Alkagen water I would recommend, depending on how hydrated you are. The Nerve Restore is also a good product. Optimizer, very, very good product as well. That product is an exceptionally good product as it relates to eyesight. So we normally recommend the eye tea. The teas that help with blood flow to the brain, circulation, that type of thing, would be the eye tea, circulation tea. Pu'er tea also helps in that situation. Miss Melissa Richards is saying, good morning, Dr. Batson and everyone. Pleasant good morning to you, Miss Richards. Yes, Mr. Savage, the Dr. Savior of the Caribbean. I hear you, sir. Marissa is asking, can you use black seed oil? Yes, you most certainly can. That's something that I use. We're actually looking to bring a line of that into the country very soon because of how beneficial it is. It's something that I always use. Ms. June Jatan is saying, I'm having my 3rd cup of oolong tea. Hot, no milk, no sugar, loving it. Very good to hear that, Ms. Jatan. A pleasant good morning to you. Miss Ayana Marie, good morning, Doc. Thank you for educating us as always. Blessings. Thanks so very much, you too. Miss Glennis Cyrus is saying, what can I use for blood clots? I am not in Trinidad. Oh, Miss Cyrus. Miss Cyrus, what we could do, we could actually send some Santulan to you. We could send some Santulan to you, and there's a product I could send for you, Optimizer, Nerve Restore, we could send as well. And I could always recommend something for you where that is concerned, because we actually in the short term have fixed our shipping situation where we could actually send things persons abroad. In the short term, the medium and long term, of course, we're still working on getting our websites and those things fully organized and in sync with credit cards and all those type of things. Because of COVID, that situation is taking a bit longer. All right, but bear with us. But as I said, we have something in the short term to deal with that. Okay, Ms. Jasmine Couture rather. Good morning, Dr. Batson. Do you have anything to help with sciatica? Yes, we do. That same omega with the K2, that's going to help you. The inflammation formula also helps as well. There is an omega that we used to have with astaxanthin in it. We don't have any in stock right now, but we should get that before the year is out. So you can always call and get some information. The joint tea is also very good as well. So that's something that you can also get as well. All right, Dr. Batson, I had cataract surgery done many years ago, my left eye first, then my right some years ago. Many years after, I developed a white coating over my cornea. Do you have anything that could help me get rid of it? Yes, sir, you could use the eye optics formula. You could always also use the MSM eye drop, the IT, and Santulan and water. I don't know where, if you're located in Trinidad, but that's something that could help you in that particular situation. Okay, Facebook family, so it has been nice. I do have to run now. Always a pleasure to be in your company. Remember, look forward to that that ad that we're going to be doing. I just have to finish speaking to Shakil as to what we're going to put there, and we're going to have you guys maybe pre-register or something like that for it. So that's coming soon. So I think by Sunday, please God, we should have that set up. So we'll be able to do that. Sorry?
There's 2 ads.
Oh, they're going to be...
Christmas ad.
Yes, there are 2 ads. So there's one with the special that we're having, as well as the one regarding financial health. So pay very close attention to that. Always a pleasure to be in your company, guys. Let me just answer this question quickly from Claudia Huggins Henry. What can someone use for blockage in the intestines? Oh, that's a serious thing, you know. The Alkagen water will help. Santulan will help. There's a product that we have called enzyme formula. That will also help as well. What will help as well in that situation, boy? Inflammation formula could also help in that situation. So I'm going to have to do a protocol for that individual to address that situation. Okay. Natasha Hilbert is saying, good morning, Dr. Batson. What do you have available for fibroids and cysts? We actually have a very good product called fibroid and cyst formula. Those used to come before in plastic. We have now changed, the company has changed the bottles to glass bottles now. Okay, Ms. Cyrus is saying, I've been sending messages on WhatsApp and no response. Ms. Cyrus, which WhatsApp you sending it to? 1-8683-149975. Just verify that for me, but that is the one you need to send it to, 314-9975. Okay? So, as we always say at Batson and Associates, if you think health is expensive, try sickness. Just now, Miss Emily Maynard McLeod is saying, can you please answer my question? Miss Maynard, what was your question? I jumped in and I tried to look at as much of questions as possible. Let me see if I find back your question, and I'll answer that last question before I leave. Yes, Ms. Moses said, Dr. Batson, you look gorgeous in red. All right.
It's 314-9975.
Okay, Ms. Cyrus, I'm going to have to check that for you. You found the question? What is it?
It is.
Good morning, Miss Nicole Vanderpool. Pleasant good morning to you. Pleasant good morning to Miss Natasha Herbert. Or she asked the question again, does the eye drop burn a bit? Yes, it does. If you're referring to the eye optics formula, it normally does give you some burning because remember, it's an eye cleanser. So sometimes what it does, it starts to burn your eyes and you'll actually see like coal when you get up in the morning because remember, it's cleansing the lens of the eye. So make sure and shake it up and use 2 drops in each eye, morning and evening. If you find the burning is a little too much, then when I say that, it's a bit harsh. Well, what you can do is actually use 1 drop in the eye morning and evening, or use it more when you go to bed, right? But it does burn a bit, but that means it's working. It's very, very effective. Okay? So again, those telephone numbers are 314-9975. That's 314-9975. And those locations, we are located on the 1st floor of Money Talks building. That's Money Talks building in Montrose, Chaguanas. We are also on the corner of Ramsey Trace and the SS Erie Main Road in Davie, as well as Red Edge Mall, Western Main Road, St. James. And we also in the Triangle building in Scarborough, Tobago. Miss Kathleen Ishmael, good morning to you, my dear. I have to call you today. Today I'm calling you because we have some stuff we need to clear up. Okay? So always a pleasure, you guys. And as we always say at Batson and Associates, if you think health is expensive, try sickness. If you think education is expensive, try ignorance. God bless and enjoy the rest of your Thursday morning. Look forward to seeing you guys on Sunday, please God, where we have a packed program. I think Sunday we have an hour. Oh yeah, but we'll continue on Facebook for an additional hour. So God bless. On Sunday I'll talk about autism. I see Pat Ashton is asking about autism. So I'm going to make sure I note that, and I'm going to discuss, one of the topics I'll discuss on Sunday is autism. Okay? So God bless you guys and enjoy the rest of your day. Take care. Bye-bye.